Hello and welcome to Spring Clinic on Western Spring Television. Here we talk about health matters and like they say, health is wealth. This is Western Spring Television and we are live on StarTimes Channel 190. You can also view this on YouTube and of course our Facebook page at Western Spring NG. Thank you for joining us today. I am Daniel Emeka. Vaccines have been described as one of the greatest achievements in modern medicine. In the year 1796, Edward Jenner came up with a vaccine for smallpox. It became the most successful vaccine, the first successful vaccine rather, because in 1980, smallpox was eradicated through vaccination. Today, vaccines protect us from diseases such as polio, measles, HPV, that's human papilloma virus, COVID-19, and of course, several other diseases. Today we'll be talking about immunization and vaccination, the myths, the fears, the facts, and everything you need to know. Spring Clinic is brought to you in partnership with the Office of the Chief Medical Director, UniOsun Teaching Hospital. And we are being joined by none other than a seasoned medical doctor with nearly 20 years of experience. She's a consultant public health and community physician at the UniOsun Teaching Hospital. She's also a fellow of the National Postgraduate College of Medicine of Nigeria, Dr. Ifedola Faramade. Hello, Dr. Faramade.
Good afternoon.
Good afternoon. Thank you for joining us.
Thank you. Pleased to meet you. Thank you very much for inviting me.
Absolutely. It's a pleasure having you.
Thank you very much.
All right. Today we are looking at a critical topic, immunization and vaccination. To start with, I want you to tell us, because most people use those two terms interchangeably. So first of all, I'd like to know, what is vaccination as far as the healthcare context is concerned in Nigeria, and what's the relationship between the two terms, vaccination and immunization?
Thank you, Emeka. Good afternoon, viewers at home. Good afternoon, everyone. I want to sincerely thank you because you have already made the work a lot easier for me by introducing what vaccines are. And you even went down the memory lane to tell us how it was invented. You mentioned Edward Jenner. Thank you. Now, let me quickly clear the air. Most cases, people often interchangeably use the word vaccination, and at times, what they actually mean to say was immunization. So the two words are not exactly the same thing, even though it has been used on several occasions interchangeably. While vaccination talks about the act itself, because when you take your child to the hospital, you are going to meet a healthcare professional who is expected to administer something, either via injection, via orals, and in some climb through nasal spray. So it's either the chemical agent or that biological agent is administered to your child through either of the means I've mentioned. So that act is what is referred to as vaccination. But what happens in there within the body system that you cannot see with your naked eye? The body responds to that thing that has been deposited in the body of that child or an adult based on the type of vaccine is immunization. So the act is you are administering vaccine and the process is vaccination. But what happens in the body is immunization. So you are immune against a particular disease by virtue of the vaccine which has been introduced into your body in a process known as vaccination. I hope I'm clear on that.
Absolutely. So doctor, it is safe to say that vaccination is a process, the act of administering a vaccine, while immunization is the outcome.
Very correct. That is what you get from the process or from the act of introducing vaccine into the body. So it involves some processes which I don't want to bore us with that. I don't want to start introducing some medical jargons or something to bore our viewers. But then within the body, there are responses to that thing that has been introduced into the body. And what you get at the end of it, outcome, like you have rightly said, is immunization.
All right. So another critical question most viewers would like to know is, who is actually licensed to administer vaccines.
Thank
Since you encourage people to take vaccines, who are those licensed? Where should people go to get their vaccine?
Okay, beautiful question. We have our health facilities. We have, in fact, the way our health system has been structured, you have very close to, at the grassroots level, we have our primary healthcare centers where people can approach, people can access vaccines. Because you need to be very careful of where you get your vaccines from because of the context or the concept of potency. Potency is key when it comes to getting your child vaccinated. You don't just present your child to a source or a health facility that you cannot be sure of where these vaccines are coming from. So the primary healthcare centers, government owns the PHCs. They are not being owned by individuals. Even though there are some private facilities where you can take your child to get them vaccinated. And beyond that, you have some tertiary health institutions. We have like University Teaching Hospital. If you present in University Teaching Hospital, there is a unit known as Child Welfare Clinic. If you take your child there, your child will definitely be vaccinated. If you have other hospitals that has been licensed to provide that service, but remember that I told you about something called potency. Nobody prepares, or no individual has been licensed in Nigeria to prepare vaccine. Vaccines come from a common source. You have local government cold stores where hospitals visit to get these vaccines. So you don't just say, okay, I've gone to, you can't go to, except for some other special cases, not like all this routine vaccination or routine vaccines that we are talking about. Not like when someone had his maybe snake bite or you have a dog bite and you need to quickly take something to prevent you from having the aftermath. But coming to the childhood vaccines that is specially designed for children below the age of 5, we commonly refer to them as under 5 children. There is a cold store at every local government level where people, private facilities, public health facilities, government-owned institutions can approach to get that vaccine. And be rest assured that once you get your vaccines from such source, you have it, the
you
potency.
have nothing to worry about. Well, Doctor, it brings me to the next question. You talked about potency.
Okay.
This is Nigeria, and many Nigerians will agree with me that in several places we are struggling with power supply.
Okay.
Vaccines are meant to be stored in cold chain. You just said that.
Very right.
At a particular temperature, very low. So normally when they come in, when you're imported, they usually import them with dry ice to keep them cold. Then of course they put them in cold rooms and all that. Then when they are transported, they're supposed to be transported with ice bags. Coincidentally, at some point, Doctor, interestingly, in 2014, I happened to be a medical representative, okay? And actually, I was, my organization was representing pharmaceutical giants, Sanofi Pasteur. You know, they make vaccines. So about 4 of us were reps covering the whole of Nigeria then. So we had to, detail vaccines to doctors, pediatricians, and other, practitioners, and also, sell to them. So one of the challenges we had then, sometimes by the time you drive from one place to another, your ice packs are no more as, frozen as they should be. So some doctors will raise concerns. You talked about the primary healthcare centers. What is the past situation there? Doctor, we are talking about safety here. Do you think they can really maintain the cold chain required for vaccines?
Thank you for that very beautiful question. It's a very beautiful, germane question that you have raised there. Nobody will be happy that at the end of being, you have taken your child to a facility to be vaccinated, and your child is still coming down with some of these preventable diseases that vaccines are designed to handle. Even though the fact that you have your child vaccinated does not necessarily mean that such a child is completely protected. But even if that infection will invade the body of such a child, to be at a very minimal, non-lethal dose of such infection, meaning that at the end of the day, we'll not really. But don't let me digress too much for the question you have asked. I can tell you that as we have it currently in this state as of today, if you visit any of the primary healthcare centers or any of the primary healthcare facilities, you will have vaccines that are very potent. There are ways of checking the potency or the suitability of a vaccine to be administered to a child. I don't want to go into the nitty-gritty of that because I am not actually here to...
Absolutely.
So, but then
I just wanted to be sure
there are ways.
That the government is doing
now, if you get to some of these primary health facilities, you will see some giant freezers that are powered not with this power holding or IBDC electricity that we have in our homes. They have, look at the roof of most private of our primary health facilities now. You will see the solar panels there. So there are solar panels. You have the thermometers there to monitor the temperature from time to time and ensure that what we give to our children are still very potent and suitable for them. So as they are coming, and you know, there are, like you, other time when you talk about, when you mentioned that, okay, you once represented a pharmaceutical, a leading pharmaceutical company, beautiful. But you agree with me that in the course of transportation, there are some steps that must be taken. Absolutely. Obviously, you will not carry vaccine from the point of manufacturing or from the manufacturer end in just something that we call it geostar. You will not use a geostar. You have these freezers that will maintain the potency at the required temperature. So by the time it gets to the end users, which are the primary healthcare facilities, you have the thermometer there that monitors from time to time and make sure that all through the time the vaccine will stay, everything is maintained at the specified temperature based on the manufacturer's specification.
Sorry to cut in. Actually, just to make things clear, on the side of the pharmaceutical giants, the pharmaceutical companies, they make sure that they always maintain the cold chain. They have some very good facilities. So the concern is always when you leave the vaccines with them, you can't value it now. It's no more in your hands. That's why I wanted you to clarify that.
Now, the point I am making at this point is we have central cold stores in the states where you know that if for any reason, if a facility is unable to maintain the cold, the temperature,
the
cold chain, you can return to the central store.
Absolutely.
So our health professionals, our healthcare givers in this domain, they are really doing fantastic job. So they know what to do. In fact, you get to some sites and they will tell you because we don't have adequate number of children to be vaccinated today or something. That will not even push them to start opening vials, all in the name of we want to give or something, and break the cold chain system. So they know that at any point, the cold chain system and the temperature must be maintained according to the manufacturer's recommendation. So that is not a fair.
All right. So very glad to, so glad to hear that. So doctor, let's talk about some of the myths and fears, concerning, immunization and vaccination, so to speak. Some people, they are so skeptical about vaccines, not just the illiterate. We have a lot of, educated people who are concerned. So can you just tell us what are some of the common myths you've experienced in your practice, reasons why people feel they don't really need to take vaccines?
Thank you for this very beautiful question. I want you to know that culture is a very big deal. Our tradition is a very big one. And in this, let me start from this western, this southwestern part of the country. Some people believe that, and because of the respect we have for maybe our grandparents, the respect some people have for maybe their father-in-laws or mother-in-laws, have been involved in some activities, in some immunization activities that there was a particular period that someone told me that my mother told or my mother instructed all our children that once you hear anybody that knocks on your door, she was even referring to house vaccination. There are times that we might even decide that if people refuse to come to the hospital, let us take it to their homes. We have campaigns that caters or handle such. It is as bad as that. And they will tell you, the mother instructed, the grandmother instructed. And once you hear them knock on the door, is either you shout for help, that they have come, so call other people. other neighbor that they should, these are the people that want to give something to our children to kill them. Because some people view it from the standpoint that it is really, some of those vaccines has been designed to cause sterility or cause infertility in our children by the time they grow up. And it is government is just looking for a subtle way to control population.
I was going to come to that.
That is one of their own reasons.
So it's just a myth. It's not real.
It is not. It is not real. It is not real. It is a statement that you can never substantiate. It is never a ploy to control any population. There are better ways of controlling population.
Absolutely.
So this can never be. That is one. The second thing, some see it as something alien, a borrowed culture. Why can you say that, okay, when you give this tiny drop, just 2 drops, how can you say it is just these 2 drops that will cater for my child through my child's entire life? It is a lie. So they have come here with their lies again. So when you see them, or when you give birth to your child, don't take your child for vaccination. Don't let them give that chemical. And I'm sure that you and me, you understand, and you must have heard of so many myths and misconceptions and rumors about COVID-19 vaccine.
Doctor, I was going to come to that, COVID-19.
I think maybe let's put that aside while I talk about the rumors around this vaccination thing, especially for children. And some, they see it as being wicked. Because how can you needle? In fact, you will see some people, they will tell you that ever since I gave birth to this child, somebody, maybe a diviner, or somebody has instructed that no needle should enter this child's body. And they will deprive that child of all the vaccines that the child should have throughout the period of childhood. And there are even some parents are just waiting. They are just sitting on a gunpowder. That will blow any moment. Some of these vaccines that they are running away from. In a way, by the time the children, especially the girl child, grows to a certain age and they begin to get sexually exposed, there are some disease entity that such vaccine tends to protect them against. So that at the end of the day, it will actually protect against having such disease. And will now, the eventual end, protect them from having cervical cancer. And which vaccine am I referring to in this context? It is the human papilloma virus. HPV vaccine, human papilloma virus vaccine. And I will tell you, especially, there was a campaign not too long ago from house to house. I know of some women that will tell you, when they come to your house, when they get to your house, call your girl children, lock them somewhere, and don't let them come out. Because if it is not true, why are they targeting girls? So it's a ploy to, and the worst of it all is what we have in the north. They believe that. Because if there's any apologies to our people in the northern part of the country, because, when you talk about general fertility rate, there are just some women that they get married as early as some culture, some tradition believe that
in the north,
once a young girl, the first menstrual flow, if it meets you under your father's roof, the second, by the time you are approaching the second, you must be on the way to your husband's house. So, and what age are we referring to? So that means if that child is unlucky to have started a menarche, we call it the age of menarche, the age that which the child will have a first menstrual flow. If that comes as early as 11, that means that child will be married off at the age of 12. And if this person is also unlucky again to start giving birth at that very tender age, now tell me between the age of 12 and 49, because usually we consider reproductive age group for a woman to span between 15 and 49. So someone that is getting married or someone that has been given out in marriage at the age of 12. Now look between 12 and 49. So let's just do the mathematics and
37 years.
And look at the number of likely children this person will give birth to. And they claim that once you want to administer vaccine to your child, no, you want to make them infertile.
Dr. Faramade, no wonder we have so many cases of cervical cancer in the north.
Beyond that, honestly speaking, it's everywhere. And I am not really
I actually saw a report, and they painted a grim picture about what is going on there.
If you look at the distribution of, or the prevalence, we call it prevalence, the prevalence of cervical cancer, it is not, well, I would say that in cases or in places where there is vaccine hesitancy, sorry for using that word, vaccine hesitancy in the sense that the vaccines are available. But people are refusing to take their children there, despite being available, for obvious reasons, misconceptions, and their own belief. So at the end of the day, the disease you are trying to prevent will continue to prevail in such communities. And that is what we are having now.
All right, Dr. Faramade. You've just talked about some of the myths now among most people concerning vaccination. But let's look at the second part of it, talking about the elite. Some elites who are quite knowledgeable, educated, but they still don't believe in taking vaccines. For instance, some people who are educated, they know there are different kinds of vaccines. We have the live attenuated vaccines, we have the deactivated vaccines, we have the conjugate vaccines, we have the mRNA vaccines. So for COVID-19, for instance, I met a lot of people who were reluctant. And to be sincere, honestly, myself, personally, I too I would rather, at that time, I had to forfeit, I would rather not travel than take the COVID vaccine, because I wasn't sure of the potency, of the efficacy of the COVID vaccine, because of the little knowledge I have of biochemistry. I hope you understand. So what can you say to that for the elites who still have their own, reservations concerning vaccines?
Maybe I should first ask you that, when are you going to get vaccinated for COVID-19? Maybe I should ask you that question. You are putting,
Dr. Faramade, you are putting me on the spot on my own show. That's not fair. That's not fair.
I won't do that. Okay. But really, let's go this route. Okay. If everybody were to have refused COVID-19 vaccine, what do you think would have happened? Now, there are regulatory agencies. What do you think is the role of NAFTA? Even though there is no amount of what to tell some people, there is no amount of education that they have that will make some people to drop what they have held on to over years. As it stands, some will tell you they were never vaccinated and nothing will move. But really, it is not a good one, because it is a kind of a disservice to the child in that house. They are making the decision that is strong enough to cost that child his or her life. We call these diseases vaccine preventable. You are not preventing your children to be vaccinated. And in a way, you are not causing problem for only your child. You are causing the problem for even the children around. Because there's a concept called herd immunity. You want a situation whereby a larger percentage of the children in that community, diseases, most of these disease entities that we talk about, they are preventable and they are infectious diseases caused by infectious agents. So that means if I am vaccinated, I know I am immunized against that disease.
And keep us safe.
Thank you for staying with us. This is Spring Clinic on Western Spring Television. I am Emeka Daniel, and today we've been talking about immunization and vaccination, the myths, the facts, and of course, everything else you need to know. And we still have with us Dr. Ifedola Faramade, a consultant public health and community physician with Uniosun Teaching Hospital. Don't forget, this program is brought to you in partnership with the Office of the Chief Medical Director, Uniosun Teaching Hospital. Thank you once again for staying with us. Dr. Faramade, just before we went on that break, we were talking about some of the myths, and you actually debunked some of those lies, talking about those in some parts of the country who believe that vaccination and immunization might be used as a form of population control, which is wrong. Then I also raised the fact about those who are the elite, who don't like taking vaccines. And we saw that a lot in the case of COVID-19, why a lot of people refuse to take vaccines. Now, let me bring another angle to it. This apathy towards taking vaccine. Why is it so? It's not just the people, Dr. Faramade. Let me quickly share another personal experience. So back then, for the pharmaceutical organization I was talking about, we had this vaccine for rabies. You know, there's vaccine for rabies. And majorly, it was one of our portfolio vaccines. And veterinary doctors are supposed to be vaccinated because they deal with animals, right? So they should be vaccinated. There's a place for pre-exposure. You know, you talk to them, you give presentations, you talk about pre-exposure prophylaxis, why they need to be vaccinated. So these guys are doctors. They know what they're doing. They know they should be vaccinated. But guess what, Dr. Faramade? Those were the most stubborn people I had to deal with. Yes, I'm calling them out now. Veterinary doctors, yeah, they were the most stubborn people I had to deal with. They refuse, most of them refuse to get vaccinated, and they are educated. They are doctors. They tell me, oh, they take precautions. So it's not just about the uneducated ones. So here are doctors who know the importance, and they are still not getting vaccinated. So here's my question. Do we really need legislation? Must we make all the vaccines mandatory before people get vaccinated? For instance, yellow fever vaccine. Okay, I got mine just when I was about to travel. I never even knew there was anything like yellow fever vaccine. Okay, it was when I got to the airport, they told me, are you vaccinated? That, oh, you can't travel without this. So I had to go take a shot. So how do we bridge this gap between the need for vaccination and people actually, accepting it?
Thank you very much for this very wonderful. Even though I'm veterinary doctor, I'm not going to take that hook, line, and sinker. I've not really engaged. Yeah, my colleagues.
Yes, you're colleague. I have engaged them, Dr. Faramade. I'm telling you, any of them can challenge
you. Will
me. I don't want to mention names.
Yeah, you will allow me to do my findings before I will take that as something to lose my sleep over, and I will actually sincerely trust me for that. I will find out. But then I'm not making a case for them.
Sorry to cut in, Dr. Faramade. Last year, for World Rabies Day, I was on a radio show in Abuja, and a vet doctor was there. So I took him by surprise. He had no idea that I knew anything about it. So he didn't see that question coming. He was a vet doctor. He was kind of their leader right there. He was part of the association. When I threw it at him, he was shocked. And he had to apologize on the radio saying they have failed as leaders. So you go do your findings. So I just told you my own personal experience. So I'm sure of what I'm saying.
Beyond that, let me quickly say this. One of the reasons that will make someone that is a supposedly elite person who is expected to know about something, because it is something worrisome when you expect somebody that should know, somebody that will be your mouthpiece or a spokesperson to other people saying no, then you need to explore further. And one of the reasons that might actually be responsible for that, for every chemical agent, for every vaccine, you have your do's and don'ts. You have contraindication, just like we have for our medicine. You notice on the literature that comes with any of all these drugs we buy, you will see indications, you will see contraindications. Contraindications meaning that if you notice this, this, and this, or if your doctor tells you this, this, and this, beware, do not take. Or if you notice this, this, and this, stop and see your doctor. But for this kind of person, most likely that you have talked about, maybe the person has a contraindication. I wouldn't know. I wasn't there. Well, in some, but obviously, contraindications will not cut across professionals. So individuals might actually have their own worries or their own, should I just put it as reservations?
Yeah, at that time, doctor, I actually thought it was overconfidence on their part.
Sorry, sir. This particular vaccine you have actually talked about, I'm sure it must have gone through some clinical trials.
Absolutely.
So now, maybe there are some stages of these clinical trials that they have issues with. But if I were you, I would have, why can't we just subject that to a research and conduct a one-on-one interview? Because if you notice that this thing is specially designed for this set of people, and they seems not to access it, then I will ask myself some questions.
Absolutely. So
I will ask questions and address, like now we have talked about myths, misconceptions, rumor. So how do we intend to manage all of this? Because if you are not taking, and you want us to give to people that have dog bites, so how do we reconcile the two?
Yeah, Dr. Faramade, so the general response then was that they always take precaution. And I tell them you are being overconfident. That was how I interpreted it.
And that was the response all of them gave.
Majority of them, they're just, you know what, Dr. Faramade, I guess here's the point. Vaccines are not they're not cheap. Okay.
They are not.
Exactly. And those ones were not being subsidized. All right. Okay. So they didn't just want to spend anything extra from their income. You get my point? So they'll tell you, oh, we are taking precautions and all that. Now, let's come, now that you talked about it, let's talk about safety of vaccines. I mean, you talk about the fact that they're always maintained in cold chain and all of that. What are some of the adverse effects, side effects of vaccines? When should people start to get worried about safety? Is it possible, doctor, for some people to react to some of these vaccines? Because every drug, has side effects. So what are some of those, side effects or adverse, conditions that might be associated with vaccines?
Thank you for this question you have had, because it is one of the things that you need to allay fear, and you need to address worries and concerns of people. If you actually and you truly mean business and you want them to embrace something. One, you can't tell mothers that the vaccines they are going to take for the children, especially the injectable, because of that is completely 100% safe. Is let me safe in quotes, and I will explain myself. Safe in the sense that even though it might actually come as very, very little, infinitesimal, but there is no single drug that will not have its own adverse effects. The same way with vaccine, even though it is not called adverse effects, but rather there's this term, adverse events following immunization. So AEFI, because it is not something that stays for a long time.
Could you please repeat that? Adverse events following immunization, for the sake of our viewers.
Immunization. Even though, oftentimes we interchange, but now that this child has been immunized against this particular disease entity through the process of vaccination, there are some things, even as common as tooth eruption for children. It doesn't come easy. So now, you want to administer, you had already administered vaccine to a child. As simple as redness at that spot where you have punctured that child, where you introduce that, you sticking that needle. For some, that spot will remain irritable for hours. And that is why some medications...
Which has nothing to do with the vaccine.
Obviously, maybe the vaccine is part of the ones that comes in the form of injectables. And you are using needle. You are not using cotton wool to inject. You need to use needle.
Needles, absolutely.
So when you have to puncture a tiny site with a needle, that child will cry. And after a while, if you touch that spot, that child may become irritable throughout that day or the next few days until that pain subsides completely. And that is why some mothers are always encouraged to give a little analgesic, pain-relieving medications. For some, it can run fever, and that fever will not last more than a few days, or few hours, I mean, not days. So, and that does not necessarily mean that that child is sick. And at times, some children, once they remember that, oh, somebody punctured, or maybe the mother or the father tried to carry and mistakenly touched that site, they flare up again and they continue to cry. So some mothers, they prefer to run away from seeing their children cry. And they prefer to stay at home. Then some, because of where they live, some believe that once they miss maybe one of those scheduled days, then the schedule is already disrupted. They should not come again. Others should. Our health professionals, our health caregivers in our accredited hospitals, they know what to do once you miss any of those days. So the fact that you are not available as that when due does not mean that you should deprive your child completely of that. Then other things that are likely to happen. In some cases, you will just see some children swelling at the site, especially that comes with BCG vaccination. You expect that, okay, your body should have some reaction at that point where that child was vaccinated. And in fact, you look around, that is one of the things you look out for with the first vaccine that a child takes at birth. So some of these vaccines, I will not tell you that it is 100%, because the safety you are asking for in this context, not the safety of the vaccine itself, but the safety in terms of how a child or howsoever it is, even adults. We have our mothers, maybe during pregnancy, that they approach hospitals for tetanus toxoid, because that will prevent them and prevent the unborn child. And adults, for COVID-19 vaccine, for instance, some will tell you that maybe for days. Some will tell you my head was so heavy, I could not lift my hand. My body was just
yes, because we had
fever.
a lot of stories then.
Yes. This vaccine is not food. We react at times to some of these food items too. So chemical agents. We talked the other time. Thank God that you are even, Emeka was even the one that reminded me. Live attenuated vaccines, killed vaccines, so all the likes.
Yeah, conjugate mRNA.
So based on the process that particular organism went through before it gets into the stage of what you can pronounce as vaccine. That is one of the things that really determines.
So there is, Dr. Faramade, so there is a probability that there might be problem. I hope you now understand my skepticism. Just a little bit from an informed position. I hope you understand.
Obviously,
so there is
yes. I'm not contesting that. It will definitely have something somehow. But in all of these cases, the benefit far outweighs the risk. So why can't we go that route?
Absolutely.
Because you know that, fine. Are we going to look at what your child will experience for just because of, in quote, 30 minutes, 2 hours, 1 day, and now deprive that child of staying healthy throughout lifetime? So let's look at this.
Yeah, and Dr. Faramade, just to be clear, for the sake of our viewers, the concern I raised was just for COVID-19. Has nothing to do with the other vaccines for, measles, for polio, for HPV. No, I only raised that just because of COVID-19, because we had a lot of controversies about COVID-19. It came very fast. Research was being done at a very fast rate. Most times, from my experience, vaccines are supposed to be, tested. Researches are supposed to be conducted for like 10, 15 years before a vaccine is released, ideally. But in the case of COVID, it was quite a unique situation, a peculiar situation. They had to come out with a vaccine quick. That was why some elites were kind of skeptical about it. So for our viewers right there, you have nothing to worry about. Like Dr. Faramade said, the side effects are just minimal compared to the benefits of being vaccinated. Dr. Faramade, here's another one. What role do individuals and organizations be playing to encourage or improve the rate of vaccination among Nigerians?
Right. Okay. This is a beautiful question again. Let me quickly take you a bit down the memory lane. And let me use this COVID-19 that we have just talked about. Let me use it to please say a few things. When in the heat of that crisis of COVID-19, I remember that it took the government to engage some opinion leaders, key stakeholders. In fact, government went as far as bringing religious leaders that that once you see this entity on the screen, people will be itching to hear what he or she have to say. I remember the religious leaders in the north, general overseers in the southwest, and some respected community leaders, because these are people in various communities they respect. And once they know that it is, for instance, the KBAC that said his members or the community should come out en masse to embrace this thing, we know that. We respect our KBAC. And we know that he has the love of his community at heart. He will not want to do something that will be inimical to the health of his people. So the same way, we have our leaders. We need political will. We need strong engagement of our respected leaders, opinion leaders, stakeholders, philanthropists, because they know that these are the various people that are very close to us at the community level that people respect. Beyond that,
how about religious leaders?
Religious, yes, I said religious leaders. And, you know, and what I've seen again, some people tend to believe what the person that owns the next stall, what the person tells. You know, I told you the other time about a grandmother giving instruction, and she's even passing it to the generation that will even outlive her. So the point I am making, as healthcare professionals too, and that is why most times when you see our mothers, when they come to the hospital, when they come to clinics, you don't just ask them, bring your child, vaccinate the child and return home. They have health talk. They engage them because you need to move from what these people know to what they don't know.
All right, doctor, we are running out of time. I'd like you to quickly address this. Our vaccines being tested and approved in Nigeria, and what are some of the campaigns going on in form of vaccination to improve vaccination, the reach and all that? But first of all, how are they being tested and approved in Nigeria? Okay,
one of the major bodies that regulates this activity of how vaccines comes into the country and how it is being distributed and go, we have a World Health Organization. World Health Organization is available in all the states of the country, and they always have their state representative. So there's nothing or any new discovery that takes place in that space that will be without the know of the World Health Organization, WHO. The same way with NAFDAC. If something is not approved by some of these regulatory agencies, obviously you cannot find it in any of that hospital, because no hospital have that wherewithal to approve that, okay, of course, vaccines will not come from the manufacturer to the hospital straight. It has some checks. There are some checks and balances that must be done. So these are some of the available agencies of government.
So we have WHO and NAFDAC.
We have WHO, we have NAFDAC, and we have immunization offices at each local government where these vaccines get to before it gets distributed to that end point where parents or mothers or caregivers are expected to approach to get their wards vaccinated.
All right. So are there any campaigns, innovative campaigns?
Okay. The other time I told you, for this state, there are immunization plus this, national immunization plus this. There are some days that have been set apart to make campaigns, to make awareness beyond the routine immunization. Because I am sure right from when a woman is pregnant, that sensitization already had started. When this child is given birth to, right from when you are pregnant as a woman, there are some vaccines you should take. Once you deliver this child at birth, the child resumes with this at 6 weeks. And it goes on and on till the age of till 15 months. And there are some vaccines that even goes beyond that. No, though we have some special vaccines, but I don't let me go into that.
Absolutely.
We are not going into that.
Yeah, I also have a lot of questions as far as vaccines are concerned.
But then, for these children, especially the under 5 children, the mothers, right from when they are carrying the pregnancy, they are quite aware of what to take, except for some, I don't want to use the word stubborn. Some, they would rather tell you, my father-in-law, my mother-in-law, or this and that. Or they will even come up with their own sentiments and their own concerns, like we have earlier addressed, that will not make them present their children for vaccination. But there is always campaign. We always have campaign awareness program and sensitization at community level, at various clinics. And at times, in fact, if you listen to radio, if you listen to media, we have utilized all sorts of handles, all sorts of medium to ensure that we engage our mothers on the importance of vaccination.
All right, Dr. Faramade, how about the successes? What are some of the successes, recorded so far and advancements in the area of vaccination in Nigeria?
I think this discussion will not be complete if I fail to mention about Sustainable Development Goal. The Sustainable Development Goals as it stands has it's aimed, especially the third goal, which is to end preventable death by the target year of 2030. What are the efforts? One of the major things we need to do to control or to prevent childhood mortality is what we are discussing at the moment. And currently, there is a target year already of 2030, and we have a particular figure in focus. If you look at it, the goal 3 this goal 3.2 clearly stated that by year 2030 we want to reduce neonatal mortality by nothing more than 12 deaths per 1,000 live births, whereas for under 5 children it's 25 per 1,000 live births.
Wow.
But if this were to be attainable and we want to achieve this, then we need to go back to the drawing table and make sure that we increase efforts to make sure that this particular thing that we are talking about, vaccination, we must make efforts.
All right.
Because that is one of the cost-effective means of ensuring that our children remain
so much
safe.
to talk about, Dr. Faramade. I wish we had more time because I have some questions I would have loved to ask you. But unfortunately, we have to go. It's been Spring Clinic on Western Spring Television. Thank you so much, Dr. Ifedola Faramade. Absolutely. Dr. Ifedola is actually a consultant, public health and community physician with the UniOsun Teaching Hospital. She is also a fellow of the National Postgraduate College of Medicine of Nigeria. Spring Clinic was brought to you in partnership with the Office of the Chief Medical Director, UniOsun Teaching Hospital. Remember, prevention is safer, cheaper, and better than cure. Stay safe, stay protected, stay informed. Daniel Emeka is my name. Thank you for joining us.